Hi, I'm Courtney Grunwald.
And I'm Allie Schwab.
And we are unpaid actresses to tell you today about anaphylaxis. We are going to Coburn's to find some anaphylactic triggers.
Wheat.
Dairy.
Nuts.
Soy.
Latex. Shellfish.
Food additives.
Food dyes.
Ow! Bees.
Now from causes, we go to symptoms of anaphylaxis.
Anaphylaxis may begin with severe itching of the eyes or face and within minutes progress to more serious symptoms. These symptoms include swallowing and breathing difficulties, abdominal pain, cramps, vomiting, hives, rashes, and angioedema. If you have symptoms of anaphylaxis, seek emergency medical attention immediately. The condition can quickly result in an increased heart rate, sudden weakness, a drop in blood pressure, shock, and ultimately unconsciousness and death.
From symptoms, we go to chemistry of anaphylaxis.
This is a visual representation of the chemistry behind anaphylaxis. Allow IgE or immunoglobulin E to be represented by the pink crystals. Allow the allergen to be represented by orange crystals. And allow the mast cell to be represented by an egg. For an allergic reaction to take place, the body must first be sensitized or exposed to the allergen. When the allergen first enters the body, it will come into contact with immunoglobulin E antibodies. These antibodies will then attach to the mast cells and basophils. When the allergen comes into contact with these antibodies, the chemical mediator histamine is rapidly released from granules inside the basophils and mast cells. These cells also produce and release other mediators such as leukotrienes and prostaglandins. The chemical mediators cause increased permeability of capillaries, increased secretion of mucus, smooth muscle contractions, etc. Systematic anaphylaxis occurs when very large amounts of the chemical mediators are released and cause circulatory collapse and constriction of air passages, which may lead to death. Epinephrine can counteract this. Local anaphylaxis is less severe, which means that less mediators are released. The symptoms of local anaphylaxis are usually associated with ingested or inhaled antigens. Effects include hives, asthma-like symptoms, hay fever, gastrointestinal upsets, etc.
Chemistry to physical effects of anaphylaxis.
Swelling of face and lips, constricted throat, rash and hives, dizziness and fainting, nausea, shortness of breath, feeling of impending doom, anxiety. There is only one rapidly effective treatment for anaphylaxis, epinephrine by injection. Epinephrine is adrenaline and it rapidly reverses anaphylactic symptoms. It is typically given through an automatic injection device. The most common injection site is the thigh. If you are near someone who is going into anaphylactic shock, call for professional medical help immediately. CPR and other life-saving measures may be required. In addition to epinephrine, treatment for shock includes intravenous fluids and medicines that support the actions of the heart and circulatory system. After a person in shock is stabilized, antihistamines and steroids may be given to further reduce symptoms.
Interview! Don't know. Not.
Hi.
There's a fire starting
Peanuts.
in my heart, reaching a fever pitch and it's bringing me out the dark.
No.
When we were 2.
No, it wasn't anaphylactic. We just got hives.
But that's a reaction.
We got hives, but we didn't go into anaphylactic shock.
See, I'll leave with every piece of you.
I would get my EpiPen and have someone send.
I will do. There's a fire starting in my heart.
Do you want to see the directions? And it has the directions right there.
The scars of your love remind me of us. They keep me thinking that we almost had it all. The scars of your love, they leave me breathless. I can't help feeling we could have had it all.
Right there. And you have to hold it for 10 seconds to take this cap off.
You have my heart inside.
Shut up, Aaron. That's not even funny.
Baby, I have no story to be.
Can't eat a lot of stuff, especially I can't even eat things that are processed.
To review, anaphylaxis is a serious, potentially life-threatening allergic response that is marked by swelling, hives, lowered blood pressure, and dilated blood vessels. In severe cases, a person will go into shock. If anaphylactic shock isn't treated immediately, it can be fatal. This condition occurs when the immune system creates specific disease-fighting antibodies called immunoglobulin E, or IgE, toward a substance that is normally harmless, such as food. When you are first exposed to the substance, your body does not react, but it does produce the antibodies. When you are exposed to the substance again, the antibodies spring into action, releasing large amounts of a protein called histamine. Histamine causes the symptoms described above.